So here we have a 49-year-old female who presented with this significant periodontal defect around a previously traumatized lateral incisor. She looks to have had a history of orthodontic treatment. I can see some root resorption occurring around those lower anteriors, and the referral was for replacement of the lateral incisor and also assessment of the periodontal status. So if we have a look at the clinical presentation of that tooth, you can see the significant recession and just up into this zone. There was a significant localized periodontal pocket on the distal aspect of this tooth and a significant labial deficiency. So the treatment plan was to remove this tooth and graft the site prior to implant placement. The way that was done was using a papilla sparing incision, given she had a relatively high smile line, and we didn't want to increase the amount of recession that's already occurred interproximally. We can see post-operatively from the graft, you see that papilla sparing incision and the scarring that's occurred mesodistally. That of course flattened out over time, but we have advanced the flap, and you can see there's a difference in the mucogingival junction, which will be addressed by removing that back at the time of second stage surgery. When we go back to reassess the graft response, we can see that she's actually had quite a bit of volumetric fill. You can see the original alveolus here, and you can see the graft material. And this was a 50-50 mix, so a product from Ozbiotech, which was Orovance, which was a mixture of cortical and cancellous bone, and mixed with 50% of the graft was autogenous, which was harvested from the external oblique ridge with a small scraper. And again, here's a further shot across, and you can actually see the original deficiency of where the tooth, or at least some of the tooth was sitting there. This is a little tack, and this was the tip of the day, is that the membrane fixation is extremely important in these types of cases, and particularly when dealing with those narrower incisions, the tack fixation really helps with soft tissue adaptation around the site. And then there's another view there. You can see there's some vertical augmentation, in particular horizontal augmentation. So what does that look like when we've gone back in? So if you have a look at the time of implant placement, we've accessed the site, and you can see the quality of that bone is significantly improved, and volume is significantly improved. And in fact, we probably have some. If I get to the occlusal view, yeah, you can see the horizontal deficiency is significantly improved when you imagine that there was no labial bone on the outer surface of that tooth. So the implant was installed. Lower implant, that's the implant there, and you can see there's still remnants of the graft through here. We want to see some homogenization of and integration of her bone over a long period of time, so we see the normal trabecular pattern, but you can see there's good density through here. The implant's installed, nice alignment of the implant. The better the bone around the implant, the better the implant's going to be long term. So have a great weekend, and that's a tip of the week. Thanks very much.